Ladies, do you know that not all spot of blood or bleeding that comes out from your vagina monthly is your menstruation? Bleeding can be a sign of pregnancy which you might not be aware of. That is implantation bleeding. So in today's video, I'm going to discuss implantation bleeding. I'm also going to tell you certain features or characteristics that can help you as a woman differentiate implantation bleeding from your normal menstruation. But before we proceed, what is implantation bleeding? Implantation bleeding is that bleeding, or rather that spot of blood that you notice that comes out from your vagina 1 week or 2 weeks after you must have engaged in a sexual intercourse, or rather 6 to 12 days after your normal ovulation. And this bleeding is as a result of the attachment or the embedment of an egg that has been fertilized by a sperm in the walls of your womb or your uterus as a woman. Many women still get confused on how to differentiate implantation bleeding from their menstruation. So there are several characteristics, or rather features, that can help you differentiate implantation bleeding from your menstruation. And one of them is the color. Normally, implantation bleeding is usually pink or brown or dark brown in color, unlike your menstruation that is usually bright red in color. Secondly is the cramping. Normally, implantation bleeding comes with this cramping that is usually mild in nature. For some women, they do not notice any cramping at all, unlike your menstruation that usually comes with this cramping that is usually mild and can range to a severe cramping. Thirdly is the consistency. Normally, your menstruation is usually thick, and for some women, they notice clots of blood during their menstruation. Unlike implantation bleeding, that the texture is usually thin and watery without any clots of blood. The fourth one is the duration. Normally, implantation bleeding ranges for few hours up to 1 day to 2 days. That is, it lasts for 1 day to 2 days. Unlike your menstruation that normally lasts for 3 to 7 days or 3 to 5 days. For some women, 2 to 5 days or 2 to 7 days. Also, you can use the timing to differentiate between this bleeding. Normally, implantation bleeding normally occur from the 6 to 12 days after your ovulation, or rather 1 week to 2 weeks after you must have engaged in a sexual intercourse. Unlike your menstruation that normally occur on the first day of your normal monthly menstrual cycle. Before we end today's video, if you are a lady and you're sure that you conceived, that is, you are sure that you are pregnant, and you notice this spot of blood or light bleeding that comes with few clots and the cramping is severe, or rather is bright red in color, please do not hesitate to visit your healthcare provider, or rather consult your healthcare provider for further diagnosis to prevent any complication that might be associated with that pregnancy.